Hi everyone, welcome back to my channel. So today I wanted to do a quick review of my first surgical consultation. So if you have been keeping up with my channel, I was diagnosed with endometriosis earlier this year, and I have been slowly getting to a point where, I'm probably moving in the direction of surgery, having it surgically removed. But as I've been doing a lot of research on endometriosis, what I've seen is that you're not just supposed to go for the first surgeon that you find. You kind of have to get some consultations with different surgeons, ask them questions, see how experienced they are, because things can end up worse than they can go one way instead of the way that you want it to go if you don't get the right surgeon. So I have 3 consultations scheduled. My first one was with this doctor. Her name is Dr. Mallory Stuparich, I think is the way that she pronounced her last name. She is out of network for, I believe, all insurance. So this is a cash pay surgeon. And because she's a cash pay surgeon, I was able to get a consultation pretty quick. The other 2 surgeons, as of this recording, it is the end of September, almost the beginning of October. And my other 2 consultations, one is in November, the other one is in February of next year. So it takes a while, unless it's a cash pay doctor. While I do have the money to pay her the rates that she has, and you will know the rates, she does have them in her intake forms. While I do have that money, I wasn't completely sure if I wanted to spend the money on surgery. But I also thought to myself, if there's something to spend money on, it would be this. And if I like her enough, or if she seems, reputable enough, I might actually just go for it, But as it turns out, she is not an option, and I will tell you guys why. So she does a free 15-minute consultation. So it's a telehealth visit. You don't have to pay anything for it, which I was a little bit weird about that, but I'll talk about that a little bit more later on. But at the same time, I was like, you know what, if it's free of charge, it's worth it, just to get a vibe for a surgeon, because I haven't had a consultation with any surgeons yet. She has good reviews. I think she used to be at UC Riverside. And so she is kind of one of the top, endo surgeons. She was very professional, even though it was like a telehealth consultation. She was very professional. And the one thing that really caught my attention was the fact that she came ready. I did have a couple of questions that I wanted to ask, but she was ready, she was ready with her own questions. This is rare when it comes to doctors. I rarely have a doctor where I walk in and they're just asking me questions and trying to get a feel for what is going on. I've had multiple doctors just look at me and go, so what can I do for you? Why are you here? Even though sometimes I'm referred to their practice by another doctor, they're still asking me well, why are you here? What are you doing here? So that was so refreshing. I could already feel the vibe when I started this consultation. So she was prepared. She came ready, ready to get into it. So she started asking me questions. She kind of already knew that she was not going to be my surgeon. And I could get that. I got that vibe from the very beginning. But she still continued with the consultation, and she was asking me questions. At one point, she had asked me about the tumor markers that I had that came up abnormal on my blood work. And I knew one of them off the top of my head, but not the other one. And I did tell her, the tumor markers are coming back down. One of them is already in range. And she said, I need you to get the paperwork out. Keep in mind, she already knew that she was not going to be my surgeon. And she said, I need you to find the blood work and give me both of those tumor markers, which tumor markers they are, and, and let me know if they're out of range or what, what the number is. So she waited. I got my blood work. I came and I, told her which ones. And she basically said, and again, this is not a response that I've been getting from the gynecologist that I've been seeing. And it was in line with the research that I have done on endometriosis and ovarian cancer. But I had been reassured and reassured and reassured by all of these gynecologists that I have seen that I don't have ovarian cancer. I mean, I had one doctor that was like, you don't have it. You don't have it. You can't predict cancer. I mean, he was just so rude to me. Dr. Stuparich basically, when I gave her those tumor markers, she said, look, you need to do this surgery at a bigger hospital that has access to an oncology department. Because when they're in there, they're going to have to run a biopsy of the tissue to see if you have cancer. And then if there is cancer, I guess they have to take it out, take whatever is there, remove it. And that's going to require, I think, a surgeon from oncology. She said she doesn't have one. So this is, I think, her own practice. I believe it's her. She's an endo surgeon. I think she's a robotic surgeon. And then I believe she has a colorectal surgeon on call because endometriosis can be on your colon and stuff like that. So she said, I don't have an oncologist. I don't have an oncology department. It's basically just her. She said, you need to get the surgery done at a big hospital, a university, that kind of thing. And she, at no point did she tell me, you do not have cancer. There was none of that. If anything, it seemed like she was avoiding saying that. She said, you have 2 tumor markers that are out of range. She said, yes, one of them has come back down, but because of those tumor markers, you're going to need a biopsy just to, at the very least to rule it out. But to be honest, she did not say you do not have cancer. She did not, at no point did she make, that assumption or say you, because all the other gynecologists that I've had have been with certainty. They tell me with certainty. One of them was an oncologist. I had seen a gynecological oncologist, and I'm thinking of doing a review of this guy on here. I did not like his attitude or the way that he was talking to me, but he insisted that I did not. I mean, he just kept telling me to my face, you do not have cancer. You do not have cancer. That's great. And I don't have a history of cancer of ovarian or breast or any of those kinds of cancers. But what I had read online was that the only definitive way to rule out ovarian cancer is through a biopsy. It's the same thing with endometriosis. The only way to diagnose it or to rule it out is through laparoscopy, actually going in there. You cannot say 100% with certainty, you don't have endo, you don't have cancer, unless you actually go in there and take some tissue out. So what she told me was very much in alignment with what I had read. And I told her, this gynecological oncologist flat out told me, you don't have cancer. I mean, he was just really adamant about it. And she asked me for his name. She said, what is his name? What is the name of his practice? And she was like, is it this guy? Is it, because I couldn't think of his name off the top of my head. And I was like kind of shocked that she was actually asking for receipts. And, I couldn't think of his name right off the top of my head. So I kind of told her, whereabouts he was located. But she seemed very put off by the fact that this oncologist, he was a gynecological oncologist, that he had flat out told me that I did not have cancer, that almost with certainty, you don't have cancer. My regular oncologist had also confirmed that you cannot rule out cancer without a biopsy. The unfortunate part is that, she said that she was not going to be able to convince any surgeon to go in unless there was further testing. And I think because my tumor markers are coming down, that is probably less of a possibility unless I move forward with endo surgery, in which case they're already in there, they can grab a biopsy. She listened to me carefully, knowing that she was not going to be my surgeon. That was what really stood out to me, was that she still gave me my 15 minutes. It was probably more than a little bit over 15 minutes. She still gave me my 15 minutes. She still answered my questions, which, to be honest, she answered my questions before I even asked them. One of my questions that I was going to ask is, what can go wrong or what surprises can occur during endometriosis surgery? That would be one of the surprises, is you have cancer. And so, I mean, I didn't even have to ask the question. And, you know, I was just, you know, I felt that she had a lot of integrity because she was very honest and upfront. She said, I'm not going to be able to do the surgery for you, but at the same time, still gave me my time, still answered my questions, still asked me questions, knowing that I was not going to be her patient. And was very much shocked, you know, at the things that I was telling her. And insisted on me getting out my blood work. She was like, no, I need you to get your blood work, and I need you to let me know those exact tumor markers, which ones they were. I was very happy that I did this consultation, because this consultation is going to, it's basically going to influence my next two consultations. I'm going to know what questions to ask, and you know what to look for now, because now I think I started off with the best surgeon that I could have possibly found. Unfortunately, she can't be my surgeon. And so now moving forward, I'm going to know what questions to ask, and I'm going to know what I want out of this surgery, which one thing is going to be a biopsy for ovarian cancer. It was really interesting, because the next day, after my consultation with Dr. Stuparich, I had a consultation with a naturopathic doctor that also has, she's experienced with endometriosis. She had endometriosis, and she works with a lot of endometriosis patients. And it's really funny because she was a naturopathic doctor, not an MD. She's very young. She's like been practicing maybe a few years, and I had to pay almost $50 for a 15-minute consultation. She's very expensive. And I just thought that was very telling, that Dr. Stuparich, who is an actual, you know, qualified, you know, robotic surgeon, didn't charge for the consultation and still gave me my time and gave me whatever knowledge she possibly could give me. And this naturopathic doctor, I literally had to pay almost $50. There was no intake. I had to fill out several forms for Dr. Stuparich. There was no intake for this naturopathic doctor. She basically said, you know, well, what brings you here today? And, you know, it's not just naturopathic doctors. There's MDs that do the same thing. They just don't ask you questions. They are not, they're not inquisitive, and they simply just kind of, you know, roll with whatever happens. So if any of you have the money, if you have endometriosis, if you have the money to pay for it out of pocket, and you don't have like really any other things, like for example, the tumor markers or stuff like that, I would recommend Dr. Stuparich. You could, depending on your insurance, you could get reimbursed if you submit, you know, to your insurance. You could get reimbursed for some of the costs. But to be honest, if you just have the money for something like this, to be honest, I found her price is kind of reasonable, because I have researched other endosurgeons that charge, I mean, a ridiculous amount. And in comparison, her fees were a fraction of some of what these other surgeons are charging. So, you know, if you do have the money and you've been dealing with endometriosis for a long time, and you want to go with someone that knows her stuff and is going to ask questions, it would not hurt to get the 15-minute consult with her. I mean, she was very helpful, and she's going to be helpful to me moving forward, because now I know what I need to look for and what I need to ask about in my next consultations. So I just wanted to put this out there. You know, I do talk about, you know, bad doctors or weird doctors, but these are the doctors that really do need recognition. It is rare. It is absolutely rare to have a doctor that is just ready to ask questions, ready to just dig in. Someone that she was very decisive and wanted answers and wanted to know specific things. She had specific questions. So I really like that. So I can't recommend her enough just off of those 15 minutes. And I wish he could have been my surgeon. So anyways, thank you so much for watching. Please like and subscribe, and I will see you in the next one. Take care.